And the meeting is live. Hello, everyone.
Great. Thanks, Eric. Hello, everybody. Steve Grove here from Deed. Happy Friday. Thanks for joining us. We are thrilled to get the chance to walk through in somewhat more detail the governor's latest plans on vaccination for the state of Minnesota. Obviously, a topic of great importance for not only the health of our state, but for our economy. The more shots we can get in the arm, the safer our business environments can be, and the more we can loosen restrictions and really put this pandemic behind us and focus on economic recovery. So thrilled to have you with us today. We have chamber leaders and business leaders and businesses themselves and labor groups and community groups from across the state on this call. I am joined by my colleague, Deputy Commissioner Kevin McKinnon who runs our Economic Development Division at Deed, and most importantly by Joanna Dornfeld, who is the new Director for Outreach and Engagement for all things related to the vaccine over the Department of Health. Many of you may know Joanna from her previous roles as the Chief of Staff for Governor Dayton, and she also worked in senior leadership roles for Andy Slavitt, who is now on President Biden's vaccination coordination team too. So really thrilled to have her with us today. She will be leading this town hall, and we'll start out with just sort of a few slides on exactly what the governor announced yesterday, just to ground everybody in what the plan is, and then really most importantly, take your questions. So there is both a Microsoft form link in the email that we sent out that you should have where you can submit questions there. But also if you're with us on Microsoft Teams right now and you see that little question mark bubble thing at the bottom, you can submit a question live there too in the chat as things come to your mind as we go through the presentation. We'll answer as many as we can. So I think without further ado, Joanna, I'll turn it over to you and welcome.
Great, thank you, Commissioner. Thank you for having me. It's a pleasure to be with all of you this morning. And a pleasure to walk you through in a little bit maybe greater detail the announcement that Governor Walz and Commissioner Malcolm made yesterday about kind of the path forward to ensuring that every Minnesotan has access to a COVID vaccine between now and our goal really is mid to late summer. As you know, the currently eligible populations to receive a vaccine are our healthcare workforce, our long-term care residents, our K-12 and K-12 educators and childcare workers, as well as people who are 65 and older. And the priority really remains to, at least in this initial phase, to ensure that we are vaccinating for impact and preventing severe disease and death. And we know that we have seen the greatest impacts on our older populations, and so we will continue to prioritize those groups here in the coming weeks. As you've heard Governor Walz say, though, with the vaccine that we have received to date and what we anticipate getting to be able to vaccinate 70% of our seniors 65 and up by the end of March. So we're very excited about the progress that we continue to make. So that's in large part the reason Governor Walz laid out kind of the path moving forward, wanting to make sure that as we continue to receive vaccine to the state of Minnesota, we're able to continue to vaccinate for impact in those most at risk, and ensuring that we're doing so kind of in an orderly way so we can be prepared to continue to get vaccine in the arms of Minnesotans as quickly as possible. So once we hit that milestone of 70% of our 65 plus population having received a vaccine, and if you want to track that marker, you can go on our COVID vaccine dashboard, where we're tracking that on a daily basis. As of yesterday, we were at 43% of our 65 plus population having received at least one shot. Once we get to that 70% mark, we are going to be expanding eligibility to a subset of people who have serious medical conditions as outlined by the CDC that make them very high risk for severe illness. Some of those illnesses include sickle cell, Down syndrome, active cancer treatment, those that are immunocompromised, and those with chronic lung and heart conditions such as COPD and chronic or congestive heart failure. Apologies. And those individuals of any age, 18 and up, who have any of those ailments would be eligible for a vaccine. At the same time, the governor will be expanding eligibility to a very targeted sector of our workforce, those who currently work in food processing plants. We know that very early on in the pandemic, our food processing plants were significantly impacted. And we know that that continues to be a place of great risk, and so we will be expanding eligibility to that group. Those two populations are relatively small in relation to our overall population, and we believe we can successfully move through majority of those individuals within about a month. At that point, we'll be continuing to expand eligibility to a number of additional sectors of our populations. The first being people who are aged 45 to 64 with at least one high-risk medical condition as defined by the CDC, informed with some additional information from our providers here in Minnesota. And you can see those diseases listed kind of in the bottom right-hand corner of the graphic. But we know that age combined with having an underlying condition, again, is an added risk for individuals of severe impact from COVID. In addition to the 45 to 64 population with one high-risk medical condition, we'll also be opening up eligibility for individuals ages 16 to 44 with 2 or more high-risk medical conditions, recognizing again their added risk. And then we'll be moving on to a much larger group of what we have been known as kind of some of our essential frontline workers. Those will be additional agricultural workers, childcare workers that are not currently eligible, those in correctional settings, additional first responders, food production, food retail, food service, manufacturing, those that work in public transit, and our U.S. Postal Service workers. And in addition to those essential workers and those with underlying medical conditions, we'll also be opening up eligibility to people age 50 and up who live in multi-generational housing. Again, recognizing that group has greater risk of not only contracting the disease, but to spreading it to elders and others in our community who are at greater risk. We anticipate being able to start vaccinating that population in late spring and being able to move through it in about 2 months or so, and then being able to open up eligibility to an additional population. And I should pause and say, once you become eligible for vaccine, you remain eligible for vaccine. So if you are a snowbird and you are out of state right now and don't return until April or May, you would continue to be eligible for a vaccine in Minnesota, even as we are opening up eligibility to additional populations. And so the number of people that will be eligible will just continue to grow, but that we also believe will match the amount of vaccine that we believe will be coming to the state of Minnesota over the coming weeks and months. Once we get kind of to that late spring, early summer, and we've vaccinated the majority of our expanded group of eligible essential workers and those with these additional medical conditions, we'll be expanding eligibility to those people who are 16 years old or older with one underlying medical condition. Again, those recommended by the CDC, and those age 50 to 64, regardless of health condition. Again, recognizing age is a significant factor to significant impact of COVID. We are hopeful that we will get through that population in kind of that early to midsummer range, and then in midsummer moving on to vaccinate all other essential workers. So those would include transportation and logistics, finance, housing and shelter, construction, IT communications, energy, media, legal, public safety, water, and wastewater. And then we anticipate by kind of that mid to late summer, then we'll be able to open up vaccine to the general population. Those who have not previously been eligible will be eligible for a vaccine. And that really is, when we get to that general population space, that is actually one of our smaller population groups, because we'll have vaccinated millions of people in Minnesota by the time we get to that mid to late summer point in time. I might pause. The only other point that I would be sure to make is this is all our anticipated timeline is all based on kind of a conservative estimate of the vaccine that we anticipate coming to the state of Minnesota. We know that the administration has been working to ramp up the amount of vaccine coming to Minnesota, as well as our pharmaceutical partners. And so if we receive more vaccine than we're currently anticipating, we'll be able to move through these populations much quicker. We do know that our problem in Minnesota is not our capacity to vaccinate. We have a very robust ability to vaccinate. We just don't have the vaccine to do it currently. And as we get more vaccine to the state, we'll be able to push that out to our vaccine provider partners to get shots in the arms of Minnesotans. I might pause there and happy to answer any questions.
Yeah, Absolutely.
Yeah, great. Thanks, Joanna. This is really helpful. I think with that, why don't we turn over to Jen Gates, our comms director at Deed. And Jen, do you want to walk through the questions and we'll go from there?
Yeah, absolutely, Commissioner. Joanna, the first question that we got is, what is being done so the rest of the state isn't waiting for everyone to get the metro and southern region vaccinated before they move on to the next phase?
So we recognize that our population is not evenly distributed throughout the state. And so we are working closely with our local public health, our provider systems, and others to understand kind of how they are moving through the currently eligible populations and at what rate, and making sure that we are equitably just distributing the vaccine throughout the state so that we can quickly and efficiently move through populations, but also quickly get vaccines in the arms of people. So again, we can continue to vaccinate for impact, to make sure that we are vaccinating those that are most at risk as quickly as possible, so then we can continue to expand to additional populations.
Thanks, Joanna. The next question is, some high school students in southeastern Minnesota and maybe elsewhere had a science trip planned for 2020 that was canceled. The trip organizers have rescheduled for summer of 2021. Would the students signed up for these trips be able to get vaccines sooner so they can still make the trip? These are rare opportunities that some have already missed due to graduating.
I think the first important point to make is that as of now, the only you have to be 16 or older, and I'm going to forget which vaccine is which. My apologies. For one, either the Pfizer or the Moderna, one is eligible for 16 plus, the other is eligible for 18 plus, and so and there are clinical trials going on right now for vaccine in children, but those have not been completed. And so at this point, if you're not of age, vaccine will not be provided to you until those clinical trials are complete. And I think, we all Minnesotans are making, significant sacrifices and have been over the course of the last year. And we are all having to kind of work together to ensure that we can, as quickly as possible, kind of continue to make progress to getting to a place where we can all be healthy and move to whatever our new normal is going to be. And so while we would love to be able to vaccinate everyone in Minnesota, whenever they are ready to be vaccinated, unfortunately, due to the supply constraints, we have to do some tiering and prioritizing to ensure those that are most at health risk receive the vaccine earlier in the process.
Yeah, Joanne, I think that's exactly right. And if I could just add one other detail, because I totally, I think we all understand the concern and the intent behind the question. And really what you're doing is you're sort of linking sort of reopening and ability to move to vaccine, which is smart. That's exactly what the governor is thinking as well. You're going to continue to see more reopening in the coming weeks and months ahead as more opportunities exist for people to get out and enjoy commerce and field trips and whatever else. There will be all kinds of activities that people can do safely without being vaccinated, so long as they take the basic precautions of wearing masks and social distancing. So I don't think we're at a point where we're only going to be able to do the things we used to do if we're vaccinated. There's still the other basic precautions of testing, social distancing, and masking that'll be important. And with young people already back in school now, we're kind of renorming that, which is good. And the research has helped us get to a better place there too. So it's all related. And I think the question does a nice job of highlighting that.
Thanks, Commissioner and Joanna. The next question is, for a caregiver who are parents of an 11-year-old child with chronic lung disease and the parents are not able to return to work, is there any category that would apply to them versus the general category this summer?
Yes, I did. I confirmed with my colleagues at the department to make sure that I could answer this question. And there is, in our healthcare worker definition under 1A, there is a category or a subset for unpaid caregivers of those who need that type of care. And so that would be a conversation to have with your healthcare provider, who would have kind of access to that information to seek a vaccine.
Thanks, Joanna. The next question is, knowing a number of seniors 65 and older are relying on their medical clinics for vaccines, when will medical clinics begin to get a higher number of doses so they can actually start vaccinating that entire age group?
Our provider partners will be getting additional vaccine when we get additional vaccine to the state of Minnesota. As I said earlier, we know that there's additional capacity in our system, not only with our provider partners, but also with our pharmacy partners and local public health and others. And the department and the administration is committed to making sure individuals are able to obtain a vaccine in the place that's most comfortable for them. For many people, that will be in their doctor's office, and they're going to want to go see their primary care doctor to go get a vaccine, but that's not true universally. And so we're making sure that we are kind of building out that infrastructure to, again, continue to vaccinate people as quickly as possible as the vaccine to the state of Minnesota increases, but also ensuring that every Minnesotan has access to the vaccine in the place that's most suited for them. And so we are absolutely committed to increasing the amount of dosage that goes to our provider partners as we continue to get more vaccine into the state of Minnesota.
Thanks. The next question is are there any clarifications around essential frontline workers and all other essential workers? Will Minnesota be following the ACIP definitions?
So Minnesota has taken the ACIP definitions and tailored them slightly to kind of meet the unique needs of Minnesota. And so on our website, the MDH's website, and I can certainly share a link with Commissioner Grove to share with all of you, is some greater specificity about the definitions that kind of make up some of these workforce sectors. In addition, the Department of Health is going to be issuing some more detailed guidance early next week that will provide that will be posted on the department's website that will provide greater specificity about all of these workforce categories. I will say, full disclosure, that there are going to be some things that we didn't quite think about, and so there's going to be some ambiguity and gray area, but we are committed to working with all of you and our partners to make sure we clearly understand the jobs and the roles, and we can ensure folks are getting vaccinated when they're eligible.
I would just add to that, and this is where I think this engagement with all of you has been so helpful for us. One of the things that we heard consistently from so many chambers and economic development leaders across the state was that hospitality workers and those in restaurants, obviously as we try to revive that industry as things get better, should be on a list of essential workers. And while the CDC put them in a lower tier in their kind of definition of essential workers, the governor proactively moved them up to a higher tier because he wanted to vaccinate for the hospitality industry, particularly restaurant workers and food delivery and food service, because of the needs of that sector in our economy that's been so challenged. So it's an example of, I think, how engaging with business leaders here has really helped the governor make the best decisions possible for Minnesota.
Thanks, Commissioner. It looks like Jim is asking, will the state have a position on what percentage of the population will need to be vaccinated in order to open up venues to 100% capacity?
I know that the administration and the governor have had a series of metrics that they have been utilizing to determine when it is appropriate to open various venues. I can speak to vaccination specifically, not tied to kind of the overall broader reopening plans, that the goal is to have 80% of Minnesotans vaccinated so that we can get to that herd immunity point. We know that herd immunity is a point in time where we really think we can rid ourselves of kind of this mass spread of COVID. And so from a vaccination perspective, what we are shooting for is 80% of the overall population. But I know other conversations are happening about how that marries with kind of the important decisions about broader reopening.
Yeah, I think that's exactly right, Joanna. I would just add a little bit of context. Vaccines clearly play a role in how far we can be reopened, but it's sort of the downstream health metrics that end up mattering most. In other words, as you vaccinate, you get lower case positivity, you get lower cases per 100,000, and you get lower hospitalization rates. And those three metrics, that hospitalization, case percentage, and cases per 100,000, are the three big ones that the governor uses in the health portion of his decision making for reopening. Of course, there's also the economics of the situation and the social well-being of our state. But vaccines, we know, will drive all those numbers down. And so we haven't entered the vaccine number into sort of the governor's calculations on that front, but they're very related because they affect the other numbers. I think as time goes on, this is going to get a little bit simpler too. Vaccinating for impact means, again, vaccinating those who are over 65 first, which is going to decrease the mortality rate in our state, and it already has. And that metric of mortality, which up till now has been really a lagging indicator, will start to take more of a forefront role in making some of these decisions, because ultimately that's what we're trying to do is prevent mortality and keep our hospitals secure and protect as many Minnesotans as possible. So this is going to sort of shift and evolve as vaccination unfolds, and I think it's a great question because it has really completely changed the option set for the governor, and it's a really good thing.
Thanks, Commissioner. The next question is, how does an essential worker confirm their status and eligibility for a vaccine? For example, are all manufacturing employees considered essential workers for a late spring vaccination?
Yep, as I mentioned, the department is going to be issuing some more detailed guidance early next week, and we do have some of those same definitions already listed on our website. And I think the first point of contact for employees to understand kind of the category that they live in is to talk and work with their employer. The Department of Health, in partnership with DEED and our other colleagues across state government, are beginning we've been in regular conversation throughout COVID, talking to our business partners, but we'll be kind of moving to that next phase of really talking about how we're going to implement vaccination of these workforce sectors. And so it'll be an important partnership between the state employers and our provider partners to ensure that folks are able to receive vaccine when they become eligible.
Thanks, Joanna. I think this next question is for you as well. This question is about the early spring group. It's asking about those over the age of 60 with heart failure and need to be oxygen dependent. Can you clarify where they would fall on this timeline?
If I'm understanding the condition correctly, they would fall in that early spring timeline. Those with chronic heart and lung conditions, including chronic heart failure of any age, would be eligible in the early spring timeframe.
Thanks, Joanna. The next question is, given that the arts and all forms of live entertainment are a major contributor to the state's economy, can arts and entertainment workers be included in the late spring vaccination group of essential workers?
Under the current definition, those employees are not currently would not currently be eligible for the late spring vaccination. I think, as Commissioner Grove has mentioned, there's a marrying of what are kind of some of those other metrics to ensure that we are able to keep people safe, but also kind of reopen our economy. And I think that's something that we'll continue to kind of be in conversation about. And as I said, we are hopeful that we will be able to continue to vaccinate folks as quickly as possible and move through these tiers and groups as quickly as we possibly can to get every Minnesotan vaccinated. But the unfortunate reality is we don't have all of the vaccine that we want right now, and so we're going to have to make some prioritization as we move through and move forward to ensure that those most at risk are vaccinated as quickly as possible, and then we'll move on to other populations.
Thanks, Joanna. Those are all the questions that we have so far. I did just want to let you know that if you do have any questions that we haven't answered, you can go ahead and type those into the Q&A right now. And I'll hand it over to you, Commissioner.
Sure. Well, Joanna, thanks for answering all these questions and for walking through the presentation. Any other points that you would want to make to this group of business leaders before we wrap?
I think the last thing that I would want to say is just, thank you for your partnership throughout the entire COVID experience. I know everyone has had to make really difficult choices and really difficult sacrifices, both personally and professionally over the last year. And while we can see some hope and the light at the end of the tunnel, we have some hard work ahead of us. And we look forward to partnering with all of you, particularly as we are looking to move through and vaccinate some of these workforce segments that we know that in many cases, employer is kind of a more trusted voice or a trusted messenger. And so we really want to partner with you to communicate to your employees when it's their turn to be vaccinated, where to go to be vaccinated, why they should be vaccinated, and if there's opportunities to do vaccination on site, or how we can make vaccination most convenient for you and your employees. We look forward to continuing those conversations and really developing a deep and strong partnership so we can continue to vaccinate for impact and vaccinate the people of Minnesota as quickly as possible.
Yeah, thanks, Joanna. Well said. I think, it is never too early to start talking about vaccination, even if your workforce is not on the early spring or late spring list of those that will get the vaccine in the next weeks. It's going to come up real fast. And the more you can do now to ensure that your employees and your workers feel safe about the vaccine, they feel well informed, they know that you support this. Really, the pathway out of this thing is to get as many shots in the arms as we possibly can. And you, as trusted leaders in your communities and people who know your workforce and your workers, many of you consider them like family, it's just going to be a big deal for us, a big deal for our state. So we're again grateful for the sacrifices that everyone here has made for the leadership across Minnesota and our business community. And thanks for joining us today. As Jen said, submit additional questions in that chat bar or at that original Microsoft form, and we will answer them very quickly. This is important to ensure everyone has the information they need for us to be successful. So thanks, Joanna, for joining our roundtable. Thanks, everyone, for tuning in, and we'll be back in touch real soon. Goodbye, everybody.
Thank you.